Hi, I'm Bob Boross, and this is my Jazz and Tap Dance Life. This is my YouTube channel for all things jazz and tap dance. I have not been here for quite a while. It's been well over a year since I posted something. And if you've been following me prior to that, well, you kind of know that I've been going through a lot with my knees, in particular having knee replacements and those issues. And that's kind of the biggest reason why I just have not been back, because I've been dealing with that. In the meantime, during that year, of course, the channel is still up, and I just want to note that we picked up over 1,000 subscribers in that 1 year. So now we're at 8,480 subscribers. So that's just great. So for a lot of you, this might be the first time you're actually seeing me or dealing with me. So let's get to it. Let's talk about what's going on with this knee. In July, or actually June of 2021, I had my left knee replaced, a full replacement. It was a tough operation. Coming back was not easy. It was not quick, but it was getting there. It had strength to it, but it didn't have all the flexibility I would want to have. And then after I sort of recovered from that, I needed something on the right knee also. So it's just about 1 year ago, actually it was Halloween of last year, 2022. I had my right knee operated on, but I only had a partial replacement, not a full replacement. So supposedly that recovery is quicker because it's only a partial. It came back quicker than the other one, but still I have pain in it. It's not the greatest thing. It's not like I just forget about it and do whatever I want to do. But the problem is now we go back to the left knee. In about March of this current year, 2023, I started to experience like a slight swelling of the knee and got very stiff, wouldn't bend on me. This is like a year and 3/4 after the initial operation. Shouldn't be happening. And so I go back to my surgeon, well, they start with the anti-inflammatory. So I did a whole bout with Celebrex, that did nothing. After that, prednisone for a steroid, that really didn't do anything at all. I did go to a new physical therapy place, which I knew of in New York. I don't have the name of it in my head, but it's right by Lincoln Center. The Specialized Dancers is run by Marika Molnar. And I went there and had physical therapy. I felt better after that, but the problem was still there. It was not getting better. And my knee, in terms of swelling, it was not swelling like a normal swelling, just really big from an injury. It was like a lumpiness, that would happen. So actually, I'm going to do a real quick share of my screen and pick that up for you. So this is a picture from maybe from about a little over a month ago. So you can see the knee. It's not like really swollen, but here on the outside, it's really puffy. I had pain in this lower area. I have pain in this other outside area. So the whole thing was just kind of puffy all the time, but I couldn't bend it. And it's getting to the point where I really couldn't even put a lot of weight on it. It was definitely impacting my teaching. I was teaching again at Monmouth University this last semester. I had 7 weeks of ballet, 7 weeks of modern. That's the way they set the course up. I didn't do that. But as I'm getting through the semester, it's getting a little bit harder and a little bit harder. So at that last point, when I saw my surgeon, it was in September, and he just kind of said, well, maybe it's scar tissue in the joint. I could do arthroscopic surgery and remove scar tissue. And in my mind, I'm thinking, that just doesn't sound like what's going on. And that's when I said, okay, now I got to go somewhere else. I got to get a second opinion. And what am I going to do? Well, I saw a commercial on television for the Hospital of Special Surgery in New York City, which is maybe a little over an hour away from me. Sounded like a great place, like they really knew what they were doing. So I made an appointment with my surgeon there at the Hospital for Special Surgery. Great, really well organized place. He examined the knee and said, well, there's obviously instability. My knee is not really strong. There's a looseness in it. He says, but you don't need an operation. He says, we're going to do a blood test. And I'm like, oh, okay. Well, what are we doing that for? So we do blood test. It comes back, well, the level of inflammation is extremely high. All right. That means the next step is to have what they call a knee aspiration. So they insert the needle under your kneecap, pull out a lot of the fluid, and then they analyze the fluids. So right off, and your results come in bit by bit over maybe like about 10 days. So right off the bat, my white blood cell count was extremely high. It was at 34,000, and the normal high is 2,000. So there's a lot of activity going on in there. The red blood cell count was also very high. Other things were also very high. And after about 10 days, because they're growing the culture and then it comes out, there is bacteria in the fluid. So I have a bacterial infection in my knee in the synovial fluid, and most likely it's attached itself to the metal and the plastic of the joint because there's no blood flow there, so there's no way you can get rid of it. So this is like the worst case scenario when you have a knee replacement. All right, so what am I going to do, doc? And normally I had always heard that if you have an infection, what happens is you go to the hospital and you have intravenous antibiotics for a couple of days, and then you continue that at home, and hopefully that's going to clear it up. He says, no, no, no. This is how we do it now. He's going to do another knee replacement, put in a temporary joint, and you wait 3 months. They retest it. If there's no infection in there, then what they do is they do the knee replacement all over again and put in the permanent joint. So I am looking at having 2 knee replacement operations within the next 4 months or so. He said usually like 3 months in between. So December 14th is my day. I'm going in for the first one, and we'll see how it goes from there. And hopefully it will be cleared up, infection gone. And then they'll do it again. And maybe that will be like March, April. And hopefully by the summertime, I'll feel a little better. So, and I won't be teaching next semester at school, unfortunately, because of this. So this is what's going on. This is not what I anticipated when I signed up for knee replacement operations. Of course, I mean, the infection is not the problem of my first surgeon. However that happened, who knows? It could be from many ways. You could cut yourself and there's a bacteria there and it gets in. You just don't know. And they don't really concern themselves with trying to figure out why did it happen. They're just more worried about how we're going to clear this up, because technically that infection, if it gets into your bloodstream and gets really embedded, I mean, it could be life-threatening. It's not a good thing. So anyway, that's where I'm at. I do want to show you one other thing. I'm going to share my screen once more, because of course you have to have x-rays when you go through all of this. So here, what I had with my most recent doctor at Hospital for Special Surgery. So this is my knee right now. That's a standard shot. And this one, you've probably seen this before. This is the side view, but they did a different view, which has never been done. I have never seen this before. So this is actually, I was laying on my back with my knees bent, and there was a box underneath my knees so that my knee was bent basically at a 90-degree angle, maybe a little bit more acute than that. And they bring the camera down right by your chest, and it shoots like a top view of your knee and catches your kneecap. I have never seen this type of x-ray before. So if you look at this over on the left side of the screen, which is actually my right knee, you can see the kneecap, but you can see that it's tilted way off to the side, and the distance right here is much less than this distance here. I haven't had a chance to speak with my new surgeon as to what is causing this. Is this the swelling that's in there actually pushing the kneecap out of the way or not? But it just seems to me that if the kneecap is off to the side like that, it's not tracking nice and straight as it slides over your knee joint. And maybe that's a cause of some of the pain that I'm having. If we look over here on the other side, the right side of your screen, which is actually the left knee, this is the one that's going to be operated, you can see it really big. There's only a small space here on the outside and a very large space in there. So that's filled with fluid or other things. Or I'm just wondering maybe, if ligaments and things from the side are so tight that it actually pulls the kneecap out to the side. But anyway, I look at this and I just say my kneecaps are not tracking in a straight and horizontal fashion. And this could be a cause of of some of the pain. So whether that will go away with the swelling, although my right knee does not have any swelling, and I still have that tilt in there. So that's a very that's an interesting idea. I'd like to know more about that, and I don't know if anybody who will see this video might know a little bit more. So anyway, that's my situation right now. I'm going back under the knife on December 14th. And if all goes well, we'll probably do it again, maybe in March or April or something like that. Maybe by the summertime, I'll be feeling good. And hopefully the whole activity of it will be better than the first shot at it. Because even though, you know, I was sort of okay after the first operation, I still had a click all the time in the knee every time you would bend it. So like it wasn't absolutely perfect. So maybe this time it will pull out a little bit better. So I hope so. So anyway, that's why I have not been around. That's why I have not been posting, or certainly not doing any sort of demonstrations of dancing, because it just really is not a good idea right now to give that a try. So anyway, I'll keep you posted. I do have a couple of other things, maybe other videos that I could post of other teachers teaching. So I'll try to get that up in a little while. So, but that's it. Okay. So thanks for sticking with the channel. Please keep looking at all the old videos, especially like my interview videos. I did so many interviews with great people in jazz dance, and there's so much to learn just from listening to them and their ideas. And so just stick with it, and I'll be back as soon as I can. Okay, I'm Bob Boross. This is my jazz and tap dance life.